Good morning, Dr. Wright. Good morning, Maria. How are both of you today?
Good, thank you.
Doing well, thank you.
Wonderful. We have a really important topic to talk about today, traveling and living with RA. So, doctor, let's start with you. What is rheumatoid arthritis and how common is it?
So rheumatoid arthritis, otherwise known as RA, is a chronic, often disabling inflammatory arthritis that can affect almost all the joints in the body. So we tend to see patients coming in with symptoms in the hands, the elbows, the shoulders, knees, feet, hips, and even the neck. So this really starts off with stiffness, swelling and pain in joints, as well as tremendous fatigue, especially in the mornings or after sitting for a long period of time. And it can affect you starting as early as early childhood. So we have 4-year-olds with a form of rheumatoid arthritis, all the way through to our seniors, especially affecting our young people between the ages of 20 and 50.
You mentioned it was disabling oftentimes, and many times people have fatigue. So how can the demands of traveling affect someone with RA?
So travel, which is often very joyous, can be very challenging for patients with RA. There is the luggage, there is the movement, there's the sitting, there's the tracking back and forth. So I really often advise patients to remember, start off by being comfortable. Get comfortable, wear comfortable clothing, especially your footwear, so that your feet are comfortable, because even if you don't have lots of damage, the feet can become very stiff and sore. Remember to take some rest breaks so that you're moving around in an airplane, you're stopping when you're driving to get out of the car and walk around. And make sure that you take your medication regularly throughout travel so that you don't have flares, or you minimize the number of flares that you have throughout travel.
So what can patients with RA do when preparing for a trip to help address RA pain?
So there are a variety of things, but I think the most important thing is to first talk to your physician. Talk to your rheumatologist so they can best guide you depending on where you're going, how long the trip is, what kinds of medicines you're currently taking, and what are the measures to do to protect yourself so that you can minimize flares during your travel and the pain that can come with flares.
Can you explain what types of treatment are available to people living with RA?
Sure. So I'm here speaking on behalf of Sanofi Regeneron, and just to make us all aware, there are a variety of treatments because, in fact, there are a variety of patient types. What works for me might not work for you, and so we have multiple options available, whether it's tablets and capsules taken orally or injections that you can give to yourself at home or in the office, or intravenous infusions given in the office, or sometimes a hospital. But we have for often a cocktail with a combination of medicines to really manage both the stiffness, the swelling, and the pain and the fatigue that can come with this disease.
So, Maria, you're living with RA, so how do you manage the pain you experience when you travel?
It's very challenging. Most of the time, it affects my feet. My feet got very swollen, and that's very uncomfortable. So when I travel, if I travel by plane, after takeoff, I get up and walk. That helps. Also, I carry a lotion with me and I massage my feet. That helps too. If I travel by car, I stop like every couple of hours to get out of the car and walk and exercise a little bit. So that gives me some relief.
Of course. And doctor, where can we go to get more information?
So it's important, if you don't have a rheumatologist and you suspect that you have rheumatoid arthritis, talk to your primary care provider so that you can have a specialist really directing your care and giving you the appropriate treatment guidance. But for travel and other tips and insights, yourramoments.com is a very helpful website to help just direct our thoughts and our approach to travel, living with RA.
Well, Maria, thank you for sharing your experience. And doctor, thank you for all the tips and important information today.
Thank you.
Thank you.